This video is made possible by our loyal Patreon supporters. Visit patreon.com/PsycheTruth.
Hi patrons, welcome to your exclusive massage video. We're going to be doing a massage for low back today, and I'm going to be working on the lovely Taya. So she is someone that really likes deeper pressure, so just keeping that in mind. And I'm actually going to start without oil, and I'm going to start with a way that I kind of like to warm up the muscles. Sometimes when a client lays down on the table, they can be kind of in a place of holding. So a nice way that you can help your client to relax is you can actually just start with some gentle shaking. And you want to make sure that your hands are far enough apart where your client feels nice and supported. And I'm really focusing on this hip area. And of course, like if you're working on, somebody for the first time, you want to make sure that, they're comfortable with you working on their hips. It's really, you can't over communicate when you're working on someone new. So yeah, this is really good for the lymphatic system as well, the part of your body that clears out toxins. It's not as good as like jumping on the trampoline, but it's pretty good. So yeah, just taking my time here, and this is good for the joints as well. Can kind of grip in our joints sometimes. And if there's tension in the low back, there's most likely tension in the SI joint around here. So I'm just spending a little bit of extra time encouraging that SI joint to be more fluid and hold a little bit less. And I'm going to go ahead and do this on the opposite side. I'm just going to go ahead and step over. And you want to just make sure that it usually feels better if your hands are about a foot apart. Yeah, I wouldn't, get too crazy with the shaking. Just kind of find a rhythm with it. And I'm going to spend a little extra time here in the hip, just encouraging this SI joint on the left to let go if it's gripping at all. And I think we're ready for some oil. I'll go ahead and grab my oil and get started with the actual massage. So before I started working on Taya, I was kind of looking at her hips, and it looks like her left hip is internally rotated a little bit. So just kind of paying attention to, the right and left, seeing, you can learn a lot just by visually seeing how the hips are resting. So right now I'm just, I guess you could call this effleurage. And I'm just going to start kind of warming up the soft tissue and these erector muscles a little bit, but really focusing on the hips. I've had a few, really just one really bad experience. I was having low back pain, and I had a massage therapist spend about a half hour on this little muscle. It's called the QL muscle right in here. And he literally spent, like a half hour on one side, and I had a hard time walking after. So I think that if I were to give advice when it comes to doing work for the low back, it's to think broadly. And sometimes often pain in the low back is a result of it's referral pain from something else being tight or out of alignment. And I'm just kind of gliding the heel of my hand over the SI joints. If you're working on someone who has severe low back pain, I would be just careful of overworking the SI joint area. So if Taya were having, spasms in her low back, I probably wouldn't be doing this, but this is perfect for where we're at today. And yeah, I'm just really warming up the SI joint, and I'm going to go ahead and go in with a soft fist and just applying a little bit more pressure. This is a nice way to work the hips, the SI joint, because there's a broader surface area, but you're able to apply, a good bit of pressure. And I do like to get into the hip flexors a little bit too, if my client's comfortable with it. Just really need to make sure that that's in your client's comfort level. So what I'm going to do is I kind of alternate between that SI joint work, and I'm going to just work my way around into the hip flexors a little bit, or towards the hip flexors, and just encouraging everything to open up a little bit. And I'm going to do a little bit more detailed work in the SI joints, especially this right side. So I'm going to go ahead and go in with my thumbs. And if you can work the SI joints effectively, you can relieve a ton of pressure on the low back. So I'm just going to go ahead and alternate my thumbs, just gliding my way over and around the SI joint. And I'm not gonna, spend too long here, but if someone has acute low back pain, I always think of, the SI joint playing a part. And Taya's right SI joint is a lot tighter, so it kind of tells me that her right hip is most likely tighter than the left. And I like to alternate between different techniques, so just kind of finding a routine for my client that feels appropriate. And again, just working my way towards the hip flexors and just giving that SI joint space to open up a little bit more and let go. And I'm going to start working my way into the coccyx, and this is another area that you really need to make sure is within your client's comfort level. So if it is, it's one of the best things you can do for overall low back health. There's a ton of nerve endings, especially the further that you go down. There's just a lot of nerve endings that can get kind of congested. So this is just really, really healthy. I'll kind of do one thumb at a time. And I know that I need to be kind of mindful when I start doing more detailed work. I can lose sense of my own body. So just staying tuned into, keeping my spine long as I work. And just spending a little bit more time here, really clearing everything out a little bit. And I'm going to just run my So I'm going to go ahead and place one finger on each side of the spinal column, and I'm going to just focus on stimulating this connective tissue along the spine. So sometimes it can get really sticky and it can make the low back feel sore. So just making sure that's nice and flexible. And just checking in, seeing how things may have shifted a little bit. Alright guys, so I am ready to go in with my forearm and my elbow a little bit. So I'm going to go ahead and actually just use my forearm to get into those paraspinals a little bit. This is a fantastic way to do that kind of work in a way that's not ticklish. So just working my way around the hip and going nice and slow. And eventually I'm going to start working my way into the glutes a little bit. And just staying mindful of my own body. I'm going to start going in at an angle and using my elbow a little bit more. And this can be a really sensitive area, so just really making sure that this area is responding before I go any deeper. If I feel like it's fighting me, then I know I need to use a little bit less pressure. And a nice way that you can do a little bit of QL work, you can, this is a really nice transition, so you can actually just go from there to, you can use your opposite elbow, and you can actually use this forearm to lengthen, help lengthen this low back a little bit. And I'm just bringing my elbow up, and this is very superficial work on the QL. It's but that's all she needs right now. So and I'm gonna go in and do the exact same thing on this opposite side. So I'm just gonna go ahead and use my whole forearm and just getting into these paraspinals a little bit, using my whole forearm. You can even use your opposite forearm to do a little bit more lengthening if you want. It can feel really nice. And finally, working my way into the glutes a little bit. And just working nice and slow, just finding a rhythm that makes sense for today. It's really fun when you can use both of your hands. It can feel really nice. All right, so I'm gonna go ahead and just anchor my right side, and I'm going to start working my way up. And really just encouraging the low back to open and lengthen here. And not just, taking my hands off of Taya, really paying attention to my transitions. And so this is the time where if I feel like one side needs a little more attention, then I'll go ahead and I'm going to go ahead and spend a little bit more time on this SI joint on the right side. I like to make sure that I do the same routine more or less on the right and left, and then I can kind of, revisit whatever I need to on the side that needs it the most. And just holding a little bit longer this time on this SI joint. And really taking my time here, but not overworking SI joint. And I'm actually going to go ahead and do a little bit of IT band work, and I'm going to get into these hip flexors a little bit more. So I'm going to go ahead and grab my oil and get into the hips. And you might want to just move any arms around that are in the way. So I'm not really overly concerned about the hamstrings. Always good to include them, but I'm more focused on the IT band and the hip flexor. So I'm just gonna start working my way up. And again, just make sure that this is work that your client is comfortable with, or your friend or whoever. And so the IT band attaches above the hip, so I'm just making sure that I'm giving this area a lot of love. And I'm just gonna do little circles. Anytime that you're working in an attachment area, you wanna definitely use your sensitivity and make sure that you're not overworking it. And finally, I'm gonna start working my way up the IT band along the outer edge of this leg, and I'm using the heel of my hand. You can even use your elbow if you want. This is my favorite way to work the IT band, with the heel of my hand. And I'm finally just going to start using a little bit more pressure as I work my way up towards that attachment above the hip. And I like to alternate work in the IT band with just clearing out that attachment and making sure that it's nice and flexible. Just doing little circles. And just a little bit more work in this IT band. And I'm just kind of checking in with my own body and feeling a little pain in my low back. So making sure I'm taking care of myself throughout the massage. And finally, I'm just going to go really slow, and I'm going to work my way all the way up, and I might kind of go over an area that feels a little more fibrous or contracted, I should say. And I am ready for the opposite side. And grab my oil. So I forgot to mention that you definitely want to make sure that you have a nice wide stance, especially if the table is somewhat low. So you just have a nice anchor where you can work more freely. And I'm going to go ahead and just start with this work on the IT band. And even when I'm doing something simple like this, I like to find a rhythm. I've never liked it when a massage has felt like choppy. So I just try to stay pretty graceful through my movements. And working my way into that attachment a little bit. And really warming everything up before I start in with the heel of my hand. This is also a nice way to actually find the IT band with your fingers. You have the most sensitivity in your fingertips and your thumb, so it's a great way to kind of find what you actually need to be working on. And I'm ready to go in with the heel of my hand now. And I'm using my opposite hand, so just working my way up. And not really going fast or slow, and just finding a rhythm. And progressively just starting to use a little bit more pressure as I, bring my hand up towards the hip. You do need to be careful. Ideally, you never want to bend your wrist, but honestly, that's pretty impossible. So just be careful of, having an exaggerated angle of the wrist when you're working. And again, just making sure that I get into that attachment a little bit, just doing really broad circles. And this is my last little run of the IT band, so I'm going to go ahead and use max pressure here, as much as we're both comfortable with. And yeah, I might do us, back up a little bit if there's a spot that feels extra tight. And that is it for today. Thank you so much for your support, guys. We really appreciate you. I want to give a special thanks to Bob, Alberto, and Casey. We really appreciate you guys, and we're just excited to keep putting out more content that you guys enjoy.